Okay, hello everybody. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and we have with us Dr. Sarah Ellis. So,
Good evening, everyone. Good afternoon.
welcome to the functional medicine class. So, we're very, very excited to have all of you. And I just want to make sure before we get started that if you can put in the chat that you can see me and Dr. Ellis and that you can see the PowerPoint. We don't usually use a PowerPoint. However, there were some weird technical issues, um, and I'm not sure why Zoom was down earlier today, and some other two platforms went out. So we kind of transitioned, right? So I just want to make sure that we don't typically do a PowerPoint for our discussion in class on Wednesday evening, but we are going to use a PowerPoint today so you can visually see some of the studies that we wanted to share with you. So please put it in the chat, make sure that you can properly see everything. And today we are going to talk about a very, very, very interesting topic. And the topic that is, we are all interested in, especially as we pass our 40s, right? Or 50s or 60s, we get more and more interested in, and that's the topic of inflammaging and accelerated skin aging. So, in today's class, we are going to talk about what is inflammaging, what are the top two root causes that leads to inflammaging and that impact our skin. And causes accelerated aging of the skin. So we're very excited. We got some cool studies to share with you. Both me and Dr. Ellis are really passionate about sharing about functional medicine and treatment strategies and really understanding the why, the root cause, right? So we can go beyond just managing symptoms and conditions and really address focus more on a corrective care approach rather than symptomatic or temporary relief, right? So Dr. Alice prepared some wonderful slides for us and some really good content. So I'm very excited about it, Dr. Alice. It's
Yeah, me
yeah.
too. Me too. It's gonna be a good time tonight. We have a aging population. Our baby boomers are getting older, and so this is an opportunity for us to support all generations and having healthy skin and reducing inflammaging. So I'm excited to get started.
Yes, absolutely. Also in the chat, thank you for letting us know, Candice and Valeria and Dana saying I can see and hear. Wonderful. Keep us updated. And Lorianne also saying that she can see and hear us. Wonderful and welcome. So we're going to keep the chat open in front of us as we go through this. Remember, the biggest advantage of being live with you is that, we can interact. You can ask questions. We can share maybe some additional resources if needed. But the goal is really to provide you with more insights about the root cause and some really interesting concepts and treatment strategies. So let's get started. I have the clicker, so as we go along, both me and Dr. Ellis, we're gonna proceed through the slides, and so let's get in. Maybe explain a little bit about what is inflammaging, right? What is inflammaging, and why did we pick this topic, right? Maybe we can start with why did we pick this topic as today's topic, right? We know that it can impact it. The inflammaging is essentially can impact our skin, and we're going to dive a little bit more into what inflammation is. but it can impact our skin. And one of the things that we talk a lot about is when we talk about inflammation is, there's the internal part, which is what's happening to our internal organs, right? But there's also the external part, which is our largest organ in our body, which is the skin. And so, just as a general overview, inflammaging, for any of you who are hearing this concept for the first time, inflammaging essentially describes a state of chronic low-grade inflammation that accumulates with age and plays a significant role in the aging process itself. Now, this is not just this phenomenal is not just contributing to chronic diseases, but also directly impact our skin. So we're going to focus today mostly on the accelerated aging of our skin. However, remember that inflammation can impact our internal organs and significantly increase the risk for cardiovascular disease, metabolic, endocrine dysfunction, digestion problems, cognitive, right? Our brain, unfortunately, as we age, we experience changes, degenerative changes. So the science of inflammation is really focused on understanding what's causing accelerated aging. How can we avoid it, right? So we can, the concept is not just live longer, but live a better quality of life, better health, and better aesthetics, right? So we'll take a look today. We'll talk about some what's impairing the collagen production, what's weakening the skin barrier and increasing oxidative stress. And we'll touch about a few important drivers of inflammation. So this is a big topic, a lot to share. And so, Dr. Ellis, you want to take us into why did we choose this topic?
Yes, let's do it. All right. So, why did we choose this topic? When I was researching inflammaging, and particularly as it pertains to skin and skin aging, what I found was so fascinating is these are a set of statistics, anti-aging statistics from 2025. And they found that they looked at the average years or age in which US women first try anti-aging products. And so here in this pie chart, we can see that the majority of women are first trying their anti-aging products 55 and above. Now that's about 47% in that age group. Now, 35 to 54 make up over at least 50% that we saw. So anywhere from 35 to 55, women in particular are becoming even more interested in trying anti-aging products. So what does that mean for us as functional medicine practitioners? Essentially, this is a group of patients that we can support by reducing their inflammation internally so that they don't have to necessarily turn to those anti-aging products that often have toxins and chemicals that can further exacerbate their inflammation and whatever conditions that they're struggling with. Now, oh, thank you for that. There's a black rectangular box on her screen, and I actually do also see it. I wasn't sure if it was just on my end. Paul,
Oh,
do you
yes.
see that on yours?
Yeah, let me reset.
Okay.
It's a part of Zoom's personality today. Uh, Let me open this up here.
Okay.
So, okay. Okay, so I'm gonna sharing this and
So while we're setting that up, if you all were kind of surprised by that slide or that statistic, you can put a one in the chat. I myself was pleasantly surprised, but excited to see that that's a demographic that we can support. Okay, hopefully that black rectangular box is gone. It's gone for me. Thanks.
yes, and let me know if it comes back. So we can it's an easy fix, so we can address that.
Thank you. Perfect. All right. So what's interesting is that inflammaging exists at the intersection of several different um, kind of demographics. So we have it exists at the intersection of aging, which is a natural process that we all go through, chronic disease, which tend the rates and prevalence of chronic disease tend to increase as we get older, as well as preventive care. So when we combine supporting healthy aging, reducing chronic disease and chronic inflammation with preventive care, we're going to be able to help support patients as they age and help reduce the impact that inflammation has on that aging process. Let's also take a look at an image from a 2023 review article. This was in the journal Biology.
Yes.
Um,
And I also wanted to add
oh, yes.
that it's a really interesting survey that was done by one of the merchant processing and lenders, commercial lenders, Lending Tree. And they found that 75% of Americans view beauty products as an essential and spend on average of over $1,700 a year. So just in case you guys are wondering, how much do my patients on average, let's say 7 out of 10 adults, that says are spending on the aesthetics. $1,700 is, I would say probably they reported average, but there's so many patients that spend thousands and thousands of dollars beyond that on procedures that are not even considered covered by insurance, like a lot of like Botox injections. And if you go to a med spas, you'll see like people coming in and out all day spending thousands of dollars on these procedures. So just in case you're thinking to yourself, is it something that is worthwhile to offer? I can tell you that think like understanding this topic and offering anti-aging wellness, weight loss in a functional medicine approach is very profitable, and a lot of patients are looking for it. So I just wanted to mention that.
Absolutely. Thank you. So let's look at an image from a 2023 review article in the journal Biology. This image does a beautiful job of highlighting the ways in which inflammation impacts our aging process, particularly with skin. So when we have inflammation, we're going to start at the bottom left corner, kind of where that elderly man is, and we're going to go around counterclockwise or clockwise, excuse me. So with inflammation, that can impact nutrient signaling dysfunction. So it's going to impact the ways in which our body can utilize the nutrients that it needs for different biochemical pathways. It's going to lead to DNA damage and genomic instability. We know that that's sort of the beginning stages and kind of sets the stage for cancer development and other issues that align with DNA damage. Inflammation can also impact epigenetic alterations. So not only can it damage our DNA, but it can also impact the level of methylation and other epigenetic changes that take place on the gene and can in fact determine or have an impact on what genes turn on or turn off. It also impacts senescence. So this we're going to dust off a topic from way back, cell biology, in learning and remembering senescence. So these are when cells are not necessarily dividing and can often lead to more aging. And so when we can reduce the level of senescence with cells, we can make healthier cells and improve that aging process. Inflammation could lead to telomere erosion. If those of you who are into anti-aging and are healthy aging, several folks talk about our telomeres. The longer they are, the longer you tend to, or fingers crossed, you tend to live, and the healthier you are as you go through this aging process. So inflammation can actually shorten our telomeres, which can impact the ways in which we go through the aging process. It can lead to stem cell exhaustion, mitochondrial dysfunction. So we are going to be, our bodies and our patients' bodies are going to be less likely to recover from oxidative stress or experience more damage due to oxidative stress because our mitochondria are not functioning properly. It can also inhibit autophagy or autophagy, depending on how you pronounce it. But that is our body's way of sort of clearing out the cellular debris and keeping everything clear. And so when we are inhibiting this process, we're building up toxins, building up dead and dying cells, which further exacerbates inflammation. And then it also impacts the way our proteins fold. So not only does it impact the genes and the genetic code for these proteins, but even if that code is correct, if the proteins aren't being assembled correctly, it can impact our cellular function as well. And so when inflammation, particularly chronic inflammation, is continuing to be present in the body, that can lead to aging or inflammaging, as
Yes.
we discussed. Now, when it comes to the skin, inflammaging actually can affect a variety of elements with the skin. So it can affect barrier integrity. Patients may present with drier skin than usual, or just being unable to really maintain that hydration with their skin. We have to remember that our skin is really directly connected to our gut. And so that barrier integrity, when we think about the gut, we should think about the skin as well. Inflammation can impact the hydration status in skin, skin elasticity, and most importantly, the skin's ability to repair itself. So, skin inflammation is not just a cosmetic issue. We're not just focused on wrinkles and fine lines, but really we want to make sure that we're addressing a deeper systemic imbalance. And by addressing the root causes that we're going to talk about today, we can actually help support both aesthetic and functional outcomes in our patients. All right, it
Wonderful.
wouldn't be a class or a podcast without a quiz. So let's get ready for our first quiz.
Wonderful. And I wanted to add something, a couple of things, because this topic, I mean, it's a really big topic, and I feel like you covered the most important aspects of how inflammation causes the how inflammation accelerates aging, right?
Yes.
And there's a couple of things I wanted to add, and that's the telomere length is very important. There's actually studies that show us that it's a controversial topic, but there are studies because it's mostly used for research purposes. But when you measure your telomere length, you can actually, and there's functional medicine labs that can measure that. You get a correlation, you get a graph that shows you what's your score of telomere length in comparison to your age, right? So, for example, let's say you're 50 years old, but your cells, your telomere length are shorter, so you might have the biological age of somebody who's 55 years old or 60 years old. That's never a good thing if your biological age is higher than your chronicle age, right? Because then it means that you are aging, your cells and body are aging more rapidly, or you have this accelerated aging. Now, that could be from the internal organs, cells, that could be the skin. But ideally, we want to correlate that. And there's a specific test that we're not going to get into all of that, but a specific test that if you are doing a functional medicine wellness programs with your patient, you can actually offer them those tests and then very specific strategies to help them to start reversing that damage. And then there's another thing that I wanted to mention about stem cell exhaustion. I used to teach a lot in regenerative medicine conferences in Vegas and the East Coast. And I had this class that I would teach them about because the focus was PRP and stem cells. And I had this class that would talk more about stem cells. And one of the things that were really interesting is that beyond specific treatment protocols that can help to support healthier function of our stem cells, there's our stem cells are used all the time to replace damaged cells in our body. And as we age, we lose the abundance of stem cell in our bone marrow and in our internal organs. And so we lose our reserves as we age. And the more injuries and the more inflammation and the more chronic diseases you have, you lose more of the stem cells. And there was a really interesting study when they pulled bone marrow from patients with chronic diseases, and that was done in China, and healthy control group. And they saw that the control group had significantly higher amounts of stem cells in their reserves than individuals that have chronic diseases. So just think about it. If you're seeing patients that have chronic diseases or chronic inflammation, it's more likely that they're running through their reserves much faster. So there are obviously specific strategies to mitigate that and support them. But it's just important to understand the process. So let's go into the quiz, Dr. Alice.
All right.
Okay.
All right, everyone. Quiz number 1. Inflamm-Aging is best described as 1, acute inflammation in response to infection. 2, a normal part of wound healing. 3, chronic low-grade inflammation that contributes to age-related decline. Or 4, a skin-specific inflammatory process. So in the chat, we'll give you all a few seconds, put your answers in. Wonderful. That one was easy peasy. You guys nailed it. The answer is number 3. Inflamm-Aging is a chronic, low-grade inflammation that contributes to age-related decline. Wonderful. All right, so as always, this is the perfect time to remind you to log into your account if you want to get a refresher on the inflammatory process and inflammation. Be sure to log into our advanced and clinical functional medicine program to learn more.
Absolutely. And we do have a specific class. So in phase 1, you're going to learn in the advanced functional medicine program all the root causes. Treatment protocol, we focus more on the clinical aspect, so more focused on treatment protocols, diagnostic labs, all of that stuff. But in the specialty classes, you have about 12 different specialties. One of them is anti-aging. So really understanding women's and men's health and the anti-aging processes. So it's like a 2.5 hours just really on inflammaging and strategies and testing and all of that stuff. So if you're interested in offering that to your patients, log into the platform, get to that module, and start building a wellness approach in your practice. So wonderful. So let's continue with root cause number 1, and then we'll get back to Dr. Ellis for the very, very interesting root cause number 2. So root cause number 1 is a big one. This is the environmental chemicals. And I'm saying it's a big one because this is really a topic that impacts all of us. Especially if you live in a major city, you're going to be significantly impacted by these pollutants. So when we talk about environmental medicine, we talk about obviously there's UV radiation, right? Which is an exposure, we're all exposed to it, right? That could be excess exposure to the sun, right? So 15 minutes every day, 20 minutes, 30 minutes, even an hour. But if you're exposed to the sun too much, you're going to have UV radiation damage. But also cell phones. Think about cell phones. We put them right next to our head most of the time. Or if you put them in your pocket, there's actually an interesting study that showed that there's an association between males putting their cell phones in their pockets and a reduction in sperm count, right? So think about that. What is that what is that UV radiation doing in our body, right? It increases oxidative stress, increases the likelihood of DNA damage, and the release of inflammatory cytokines, right? We also have air pollution. So air pollution we measure as what we call PM, which is fine particulate matter. So fine particulate matter, you can actually test them. I've previously purchased devices to test them. I give them to my patients. Those devices can go anywhere from $30 to $100 to hundreds of dollars, but simple ones that I would sometimes give patients and loan it to patients for a couple of weeks and then they return it. But you can actually measure particles matter inside your house and you can actually filter them out. That all the way to lead in old houses and asbestos in the roof and things in the air. There's like thousands of those different chemicals. Obviously, smoking is another one. So there's multiple different environmental factors. So when we look at the impact of those factors, I wanted to share this with you. This is from a clinical study it's called the Skin and Inflamm-Aging. It was published in the Journal of Biology. So essentially, what happens from left to right is you got healthy skin, it's got nice elasticity and collagen. Over time, the aging skin goes through a number of alternation that contributes to dysfunction and the addition to chronological aging. So certain environmental stimuli, so that includes the ultraviolet and other forms of radiation and other forms of pollution that essentially trigger that inflammatory process. The skin function naturally declined with age, and there's accelerated exposure. Now, reduced extracellular matrix proteins in the dermis results in wrinkles, for example, right? So it depends on the tissue that is impacted. But if there is a loss of extracellular matrix proteins in the dermis, you have more wrinkles, you have elastosis, you have a thinner skin. This is very much impacted by environmental chemicals and that ongoing inflammation that causes damage. Now, let's take a look at a really interesting, another interesting study, an article was published in 2022 in the journal Cells. And this one gives us a little bit more information in terms of what are some of the potential root causes. So what we can see here is that we have there's several processes here, right? So air pollution, number one, air pollution can accelerate aging of the skin by introducing oxidative stress. Now, where's that oxidative stress coming from? So every time we have inflammation, right? Every time we have inflammation in our body, that could be systemic, subclinical inflammation. Those inflammatory cells will get to a certain area and they will start secreting the pro-inflammatory cytokines. That could be interleukin-6, that could be tumor necrosis factor alpha, whatever it is, that different inflammatory cytokines. Those are supposed to fix the damage to the tissue, but with chronic inflammation, they don't stop. So we have lost the brakes in the car, right? So the car just keeps going and going and going and going. And so inflammation, the chronic inflammation is a state in which there's excess activity of the immune system that is out of control. And that causes the increase of these free radicals that are supposed to kill bacteria or viruses or whatever it is, and leading also to cellular senescence, which Dr. Ellis already mentioned. Cellular senescence essentially means that those are cells that are, let's call them damaged or functionally damaged, and they're just not working, right? They're just not working properly. And we talk more about it we have specific classes on cellular dysfunction and how to test for it, how to fix it. But just remember that many of the chemicals that we're exposed to, heavy metals, particles matters in the air, um, heavy metals from food, water. A lot of those chemicals can cause ongoing inflammation, reactive oxidant species, and leads to damage to our genetic material and damage to our mitochondria. So now our mitochondria can't produce energy properly, right? So you can see where I'm going with this. This is like a vicious cycle. So that's one of the issues. Number two, these pollutants either penetrate the skin, actually penetrate the skin barrier and affect the skin directly through systemic inflammation after inhalation. After the body, so once in the body, they increase the amount of reactive oxygen species. They damage our DNA of the cells, the proteins, the lipids, and of course, as I mentioned, the premature senescence. Premature senescence means that if your cells have a certain expiration date, right, then that expiration date is gonna come sooner, right? The damage will come before the expiration date, and that cell will not be functionally will be functionally damaged. So that, especially when we talk about skin cell, we talk about keratinocytes and fibroblasts, and they release a lot of pro-inflammatory factors that are called SASP, which is essentially senescence associated secretory phenotype, and they can contribute further to chronic inflammation. So what we see in here is there's something that causes inflammation, a certain factor that you're exposed to. That inflammation causes cell damage, right? And that cell damage causes more inflammation. And that's where we get this vicious cycle. Patients comes to see you and they're like, I don't understand what's happening. I'm 40 years old, but I feel like I'm 60, right? Or they come to see you and they already have accelerated aging of the skin. They got more wrinkles than they should have. They got more pigmentation. They got more damage to the skin, right? And they just superficially try to fix the problem without addressing the problem from the inside out, right? Which is different ways to do that. There's different ways to do that, but we have to figure out what's causing it, right? That's the $1 million question. What's causing the damage, right? So there's different ways to figure that out, but there's a few of the strategies is obviously to take more antioxidants, anti-inflammatory compounds, right? So there's different strategies that we can talk about to help to mitigate that. But if the patient is also having a problem with the excessive exposure or their detox pathway does not work properly, you have to know that as a practitioner because they might need support in those aspects, right? We can't just treat the skin and the body keeps accumulating these toxicants, right? So that was a really interesting article. It's called "The Effect of Air Pollution on Cellular Senescence and Skin Aging." It was published in the Journal of Cells, and you can read more about that if you want to, or you can log into the Advanced Functional Medicine portal and learn more about these. We have specific classes on detox, environmental chemicals, testing, treatment protocols, the whole thing. So let's finish up this section about environmental chemicals with another pop quiz. So this is pop quiz number 2. So which one of the following environmental factors is most strongly associated with disruption of the skin microbiome and an increase of inflammatory signaling? I'll give you some options. So one is low humidity, B, air pollution, C, dietary fiber, and D, cold temperature. So put it in the chat. Which one of the following you think that has very strongly associated with disruption of the bacteria that helps us on the skin to control inflammation, to protect our skin, and then inflammation? Okay, so let's take a look at the answer. So most of you have said B. Wonderful, wonderful. So let's take a look at the answer, and the answer is correct. Air pollution that we talked about a lot. is one of these factors, right? So there's different things we can do externally. We can filter the air. There's HIPAA filters that can help us do that very affordably. But also to look at the patient's environment. What environment do they work and live and sleep, right? Looking at what they're putting on their skin, looking internally, what's happening with our internal pathways, our inflammatory pathways, what's happening with our detox pathways, right? Those are all important, and there's signs and symptoms when things go wrong, right? That's how our body telling us that things go wrong. There's signs and symptoms. So this one is a big one. Um, Dr. Ellis, anything that you wanted to add to this topic of I know it's a big topic, but anything you wanted to
Yeah,
add
no,
to
that
it?
was, I'm so glad that we touched on the environmental aspect because I think that our patients usually go for, the topical things, the creams and the serums and all those things. When an easy fix is addressing their environment, cleaning up the air that they're exposed to, as well as considering the things that they put on their bodies. So I'm glad that we were able to kind of start with that because I kind of consider that to be kind of low hanging fruit, easy changes that we can encourage our patients to make.
Yes, absolutely. And we can probably say the same thing about almost every chronic condition that our patients are coming with, right? The easiest way is to think, oh, I'll just give them a prescription of metformin for their diabetes and send them home, or I'll give them a prescription for their hypertension and send them home. And hopefully cross our fingers, the numbers will
Yeah.
get better. But then do we really address the root causes? Right? Like what's going to happen in the long term when we don't address the root cause, what's causing the condition. So I'm glad we're focused on the skin, but just remember the general concept applies to other conditions. So the gut is a big one and it's really, really important. So take us in, Dr. Ellis.
Thank you. Yes. I love talking about the gut microbiome because, as you all know, I think the phrase is it all starts with the gut, and the gut connects to just about everything. And so the gut plays an essential role in skin inflammaging. And that's because it involves the gut skin axis. So the gut and the skin communicate with each other through the inflammatory mediators, short chain fatty acids, all of those things. Now, the gut skin axis is a unique combination of the immune system, metabolic health, and endocrine health, as well as microbial pathways. So let's kind of get into the specifics of this whole gut skin axis. Let's take a look at a couple of images from a review article in the journal Life. It's a 2022 article. And the first image shows how gut dysbiosis and the circulating endotoxins can lead to inflammaging, particularly in the skin. So let's start on the left. We see here our thin line of colonocytes. And we can see that when we have the more gram-negative inflammatory endotoxin containing bacteria in the microbiome, they tend to produce pro-inflammatory cytokines. They produce lipopolysaccharide or LPS that can damage the colonocytes, weaken those tight junctions, and cause leaky gut. Now, leaky gut then turns on the inflammatory process. So we see here, we have these Peyer's patches. You may remember from anatomy and physiology, your Peyer's patches are essentially the immune cells that exist in your gut. And so they also release pro-inflammatory cytokines to kind of recruit the immune system due to the presence of these bacterial components and toxins. What we see is that intestinal dysbiosis is age related. So the older we get, the population of bacteria in our gut changes. And what we tend to see is we see a loss in the Clostridiales family. You don't worry about remembering that and knowing exactly how it ties in. We'll talk more about that in the sections where we cover the stool testing. But also we see a loss in bifidobacterium. Now, bifidobacterium is a very important probiotic, a very healthy type of bacteria. And so when we lose that population, we lose some of the protective effects. But then we also see that there's an enrichment of proteobacteria and enterobacteria. Now, this is a problem because these two groups of bacteria contain those endotoxins. So they contain the inflammatory molecules that further worsen leaky gut and can lead to skin issues. Now, when we have quite a bit of circulating pro-inflammatory cytokines and lipopolysaccharide, that is going to lead to the immunosenescence that Dr. Cohen talked about just a little while ago. And so when we have that accumulation of those senescent cells, that leads to further inflammaging. And then also we see that the external perturbations, kind of like the environmental factors that we talked about earlier, the air pollution and all of those things, they can cause systemic aging. So it doesn't just affect our skin, but our body as a whole, and can change the bacteria in our skin or lead to skin dysbiosis. Now, when we have skin dysbiosis, that can cause aging skin, development of inflammatory skin conditions. And so this picture is a great reflection of the ways in which internal dysbiosis and skin dysbiosis can impact skin aging. Now, if we look at our next image, this shows that the way that external perturbations like the air pollution can affect both the gut and the skin. So when we take a look at this next photo, we can see that on the left, oh, sorry, Dr. Saul, can we go to the next slide? Thank you. Perfect. Okay, so we see here on the left, say we have external issues and challenges like having a poor diet. We have a patient that eats a poor diet, standard American diet. They're taking antibiotics or have recently gone through several rounds of antibiotics. Perhaps they're exposed to xenobiotics, so we haven't had a chance to clean up their personal care products. Exposure to pathogens, all of these things impact the gut microbiome, as we see here. It can impact the levels of short chain fatty acids that are produced in the gut. You may remember that these are anti-inflammatory compounds like butyrate and acetate and propionate. It also impacts the way that bile acids are metabolized in the gut. In the presence of bile acids, certain secondary bile acids can cause gut inflammation, as well as it can impact neurotransmitters. What I really wanted to highlight is that some of these internal factors can also impact mucin production. Now, this is going to be critical because mucin production is our protective layer in the colon and in the gut microbiome. And so when we don't have a lot of that mucin being produced by the goblet cells in the colon, we're going to have a shorter, smaller amount of protection. And then that could also worsen leaky gut and cause inflammation. Now, on the skin side, exposure to UV rays, chemical exposures, pollutants, trauma, pathogens, and as well as antibiotic use. And I also wanted to point out the use of antibiotic soaps. So, we're thankfully 5 years out from COVID, but so many of us have used antibiotic soaps, antibacterial soaps, antibacterial hand sanitizers. And so that can change a patient's skin microbiome. And when the skin microbiome is altered, we have changes in the local immune activity. So the immune cells in the skin behave a bit differently than they normally would. We see changes in wound repair. So patients tend to have more difficulty having their skin heal better. And then also we see changes in really the environment of the skin. So it changes the way that the skin makes antimicrobial peptides, the amount of sebum the skin makes, as well as the skin's pH. Now, it's important to note that you'll see these bidirectional arrows between that skin segment and the gut, because that shows that there is a connection between the two. Intestinal dysbiosis can impact skin dysbiosis and vice versa. So, by addressing the gut, we're able to really address two aspects of skin inflammation and inflammaging. Dr. Tall, when you are addressing sort of aesthetic or skin issues in clinic, do you usually reach for the environmental factors first, or do you address the gut first?
That's a good question. So I always try to look, these are two major root causes, and that's what we're talking about those. Um, where I typically start is I recommend to do like a full review, right? As every functional integrative medicine practitioner knows, which is looking at your diet and then environment and then gut and then looking at signs of nutritional deficiencies and cellular dysfunction or senescent cells. And so there's different factors we want to look at. There's also the hormonal shifts that can impact the skin, right? So in our practice, we use the evaluation tool that the Academy provides. So we have used that for years, and it saves us about an hour and a half each time in the evaluation, because the patient fills it up and then they share it with us or bring it with them, and we can see in like 2-3 minutes which categories of root cause has the highest score. It might need the most attention, and then we focus on both. I would say that with patients with metabolic conditions like weight gain, diabetes, the gut is, just from my personal experience, the gut is almost always involved. There's always some sort of dysbiosis, even if they don't have significant GI symptoms. Like even if they don't complain of diarrhea or constipation or bloating or whatever it is, like we've seen so many of those patients when we tested, we found some issues, right? We're not going to get into all the different biomarkers. There's lots of them, but even lower short chain fatty acid, right? That can impact our metabolism and put us in more pro-inflammatory state, right? So there's so many factors we have to look into, but this is really good place to start. These two topics that we talked about, the environment and the gut. And um, I saw that you prepared a nice quiz for them.
That's right. Quiz
So,
number three.
okay, so
All
let's go into
right.
it. So pop quiz number 3.
Perfect. All right, everyone. Which of the following best explains how gut dysfunction can contribute to skin inflammation? All right. We have A, the gut produces melanin, which affects skin tone. B, poor gut health increases collagen production in the skin. C, increased intestinal permeability allows pro-inflammatory compounds to enter circulation, promoting systemic and skin inflammation. And D, you guys are already on it. D, gut bacteria directly synthesizes retinol, which reduces wrinkles. You all are brilliant. You already have the answer in the chat. The answer is C. As we discussed a few moments ago, increased intestinal permeability caused by inflammatory bacteria and endotoxins allow pro-inflammatory compounds to enter our circulation, and it promotes not just skin inflammation, but systemic inflammation as a whole. Great job, everyone. So we've done a really great job of going over these root causes, so the environmental factors, as well as how the gut microbiome impacts it. So now let's talk about what to do. Once we have addressed these two environmental factors, we know what's going on in terms of the root cause. How can we restore our patients' health in regards to skin and inflammation? Dr. Tall, what are your thoughts? Maybe we can do the
Yeah.
first product.
Yeah, I think that's so I think that's really good approach, and the reason we also talk about supplements, obviously, is because um, nature has given us these amazing compounds that have these wonderful pharmacodynamic and these pharmacological compounds, right? Some of them are phytonutrients and polyphenols, and there's so many different groups of compounds. And um, there's a couple of reasons why we like to talk about supplements. One, while we address the root cause, we don't want to just let the patient sit there, right? And I've seen that happen sometimes in functional medicine practices where the practitioner was maybe not trained in integrative medicine as well. So they tell the patient, we're gonna figure out the root cause. In the next 3 months, we're gonna figure out the root cause and then we're gonna address it. And then what do you think the patient goes home after paying, spending an hour with you, paying money, right? Like, what do you think the patient thinks to themselves when they're like, in the next 3 months, we're going to figure out the problem, right? Once we get the lab results in a month or two, we're going to know more, right? It's kind of like imagine that your AC or your fridge or your washing machine at home are now broken and you call in a technician, you pay them $150 to fix it, and they sit there after an hour, they look at you and they say, Mr. or Mrs., in the next 3 months, we are going to figure out what's wrong with your fridge or what's wrong with your washing machine, right? You're not going to accept that, right? Because right now you're struggling. You have a problem, you're looking for a solution. So it's always really important to learn the integrative medicine approach because as you address the root cause, that's the right thing to do for your patients. We have to provide for them with strategies they can use right now. If they come in for pain and arthritis, know the strategies and treatment protocols for pain and arthritis. If they come in for fatigue or skin condition, in our case right now, we're talking about accelerated skin aging. So that's what we're going to talk about, right? And it's important to know both the natural alternatives that we can use to help our patients improve their condition and feel better. So they're not more motivated to continue to work with you, and also the root causes. So that's really important. And there's a couple of products that we wanted to talk about. So I'll mention the first one, and then Dr. Ellis will go into the second one. So here's the first one. So this is really in the spirit of the gut function that we have talked about. As we mentioned, when we change our gut bacteria, it's going to have an impact on the bacteria in our skin. Now, beyond that, we're not going to get into it today, but gut bacteria can impact the bacteria in your mouth and impact oral health. There's also some association that was reported between vaginal bacteria and gut bacteria, right? So, it's interesting, and it's a topic that every healthcare practitioner, in my opinion, should learn about. And so, this is one of the products that allows us to impact the skin through impacting our gut bacteria. So this product is based on a really interesting research from 2023, and we put the citation here if you want to read more about it on the bottom. This product is called Skin Probiotic. Now, this was an animal study published in 2023. Animal study obviously allows us to do things that we cannot do on human studies. and allows us to kind of get a better understanding of what's going on there. And this involved administrating a very specific strain of probiotic. It's called B coagulans, and they observed several outcomes. The first one was enhanced skin hydration and barrier function, which is great. The more hydration you get in your skin, the better, because it improves the skin barrier integrity, and it looks better, right? So this specific bacteria reduce the transepidermal loss of water, and it increased the screen hydration. It also modulated the inflammatory response. So it decreased the inflammatory cytokines, interleukin-6, tumor necrosis factor alpha, and also increased the anti-inflammatory cytokines, which is, for example, interleukin-10. So in the advanced functional medicine program, we actually start by talking about the functional immunology. And functional immunology means what impacts our immune system to causes inflammation, secrete inflammatory cytokines, and how can we introduce more of the anti-inflammatory immune cells like interleukin-10, right? How can we regulate that inflammation? So in terms of the skin, this product was found to help to regulate that inflammation that irritate the skin. It also had some metabolic changes, which was really interesting. Like had a similar impact to nicotinic acid and pantothenic acid, which are associated with improved skin health and also reduce intestinal permeability. So that's one product you can look into, which again, it's called Skin Probiotic Plus. So based on the clinical study with animals, this company created this product called Skin Probiotic. You probably have to recommend to use it for at least 3 months, if not double that, to allow those changes. And of course, hydrate properly. You have to make sure you hydrate, right? So over 10 cups of water every day at minimum. That's really, really important. This is one of these products. Anything you wanted to add to that, Dr. Ellis?
Yeah, I was so glad we included this product because I think when we think about probiotics, we tend to think about the many lactobacillus strains and the many bifidobacterium strains, but the bacillus spores are so unique. They have a special spore shell that protects it, so it actually survives the gastric acid and our digestive enzymes and actually gets to the colon to reframe the gut microbiome and change the environment. So it's a great way for you all to sort of experiment with different bacterial strains and learn how different bacterial strains can impact the gut and skin. So I was really glad to see that.
Yes, absolutely. And you mentioned something really important, which is when we recommend, as we go through the program and we focus on, we have like these 12 specialties classes, like on metabolics or diving into autoimmune condition or geriatric or women's health. We talk about specific probiotics and protocols for specific conditions. And this is so important because I've seen so many patients that are just buying probiotics, right? Either off the shelf or just buying something because they go home and ask Dr. Google, what should I take for my whatever, right? And it's I've seen it so many times as again, just my own personal perspective, as if it's not evidence-based, it's in so many times and it's not a professional grade supplement, it's a waste of money. This is where patient comes back and tell me, oh, I already tried this and this and this. It doesn't work, right? So many times when I start digging into things, I found out that what they have tried is just a random species of probiotic that has nothing to do with whatever they're trying to achieve, or a random compound, or there's just no evidence for that. They just read it somewhere in a blog, So we want to use evidence-based protocols, and that's all our protocols are exactly that. So you're going to learn specifically what to do for each one of those conditions. So yeah, and now we have another really interesting. So we talked about from the gut out. Let's talk about another really helpful supplement as well.
Yes, I was very fascinated by this product. Um, this is the two products that we recommended, really give you a comprehensive approach to supporting your patients with skin inflammation because we're able to change the internal landscape. And now we have a skin probiotic oil that can change the skin dysbiosis or microbiome landscape. And so this is a product by a company called Kala. I believe they are a Danish or European company, but they do ship to the United States. And this is a really interesting skin oil that has a mix of some triglycerides to really help with that skin nourishment and skin hydration, some different oils, jojoba and castor seed oil, but where it shines is this special and unique strain of lactobacillus. I was practicing that. Lactobacillus plantarum. It has two special strains, as well as a couple of other antioxidants. Now, this is a very interesting strain of bacteria because this company actually invested in their own study and research, and they did an exploratory clinical trial just to see the effects of this oil. And it contained live strains of these bacteria, and they studied it on skin aging in healthy female participants. And over 56 days, the probiotic oil was applied twice a day. So they had about just shy of 2 months of applying this oil twice a day. And then they assessed skin changes. And so they looked at the skin hydration and elasticity and found that this probiotic skin oil statistically significant showed a statistically significant increase in skin hydration and elasticity, which highlights that bacteria's ability to support and enhance the skin barrier and dermal structure. They also saw a reduction in wrinkle depth. So there was a visible decrease in wrinkle depth and the surface roughness or texture of the patient's skin, especially in the areas that are prone to aging. So we're talking that crow's feet region just around the eyes. What they also saw, which is particularly interesting, is they looked at the anti-inflammatory and antioxidant effects. And so they didn't necessarily measure the markers directly, but what they found was a reduction in some of the anti-inflammatory markers, and they have found that the lactobacillus plantarum strain of bacteria actually has its own anti-inflammatory and antioxidant properties that has been shown in several in vitro studies. What's really great to know is if you have patients with sensitive skin, they found that the probiotic oil was well tolerated. There were no adverse effects reported, which reinforces its use as a safe topical intervention to support healthy skin health as well as reducing skin inflammation. So this is one product that you can consider adding into your toolbox when supporting patients with their skin health. And I think it would pair beautifully with that Bacillus coagulans oral probiotic as well. So we have spent a great amount of time today talking about skin inflammation, the way that environmental as well as gut microbiome changes can impact the skin, particularly how the inflammation impacts the skin. Do you have any like closing clinical pearls that we can share with our amazing functional medicine providers?
Yes. So I think is the first one is really look at the whole picture, right? That's always important, as we already mentioned. Look at the whole picture and then keep on advancing your skills. The more strategies you learn, the better you can help to not just identify, as I always call it the functional medicine detective, right? Or the root cause detective, really identify what's triggering or triggered or are currently contributing to your patient's accelerated aging. It could be something visual, like in their skin. That could be inflammatory also in visual, like, like eczema or whatever it is. But remember that it can, in so many cases, it can impact our internal organs. And sometimes we don't see it on the skin, right? Sometimes you have mild symptoms like dryness or slow healing skin issues, right? Sometimes there could be multiple issues that can occur. But remember that the skin is really the reflection of the gut, and it's also the reflection of our inflammation and our repair system, includes stem cells and immune cells. So, and it's also a reflection of our endocrine system, and it's all ties together. When we start diving deep into the gut brain axis and the endocrine gut axis and the right and the how the environment impacts our endocrine system, it all ties together, right? So keep advancing your skills, keep learning more. There's a lot to learn about the gut, right? And there's a lot to learn about the environment and then the detox pathways. But when you understand the mechanisms, you understand the how to identify those and evaluate it with your patient. When you learn those properly, you can start identify the signs and symptoms of dysfunction or imbalance just by having conversations with your patient. And of course, you can take the as a part of our community, you will have access to the evaluation tools and all that stuff you can use. Those are free. You can use them. You get a lifetime license to use those with your patients, so you can essentially use them. And we used to save our patients a lot of money in lab testing. That just by really identifying and fine tuning it to what is the one or two things we need to focus on that will make the biggest change in their lives, right? So we talked about a lot today. And of course, if you're interested in learning more, keep on advancing your skills. The Advanced and Clinical Functional Nutritional Medicine program. This is a certification program for healthcare practitioner. Remember, it's on demand and self-paced, so you can access whenever you want during the week or on the weekend. It's focused on clinical application. We do provide you specific practice building classes. So if you're interested in offering private consultations, we got registered nurses, physicians, PAs, pharmacists, we got chiropractors, we got acupuncturists, it's only for healthcare practitioner. This is not a coaching level program. This is an advanced practitioner program, but we do have classes that will show you how to grow up your own practice. And then it's more focused on the clinical side, and you get all the treatment protocols from us as well. If you got any questions, reach out to us. We are going to be done for today because we took a little extra time. This was such a big topic, but we're always here to help you advance your skills. And also remember that many of our community members, because they feel so confident and they have all the treatment protocols and the tips of their fingers, and they have the coaching and the guidance from the mentors and our medical coaches, then they're doing very well. Most of them are charging between $200 to $800 per session. And so if you want to check out some of those to kind of get a little bit of inspiration for yourself, go to our website and you can check out these classes and check out some of our graduates, what they're doing. You can check out Gina, who built 2 years into the program, built a very successful practice with she's got 3 months waiting list, and she's getting paid $800 per session. So that's phenomenal. We want all of you to be very successful, not just helping your community, but also getting paid well for helping others to achieve their goals, right? So that's really important. So I want to thank Dr. Ellis for putting this together.
My pleasure. It was fun.
Yes, and presenting and sharing her years of experience. And it's always a pleasure to be here with you. And remember, as usual, we appreciate each one of you for being here, advancing your skills, and also being there every day for your patients, providing them with solutions that other practitioners just don't, right? Don't offer them. So you're going to be the go-to person when they are suffering, they struggle, and they're looking for answers. You're going to be the go-to person that will give them those strategies and solutions that will help them. And we're with you all along the way. So thank you for being here again. Have a wonderful evening. Take care in the meantime, and reach out to us if you got any questions about the program. We got some really awesome promotion for April. Reach out to us. We'll be happy to give you more information. And yeah, and take care of yourself in the meantime. Bye,
Absolutely. Have a
everybody.
great night, everyone. Bye.